Hi, everyone. Thanks so much for joining me today to go over some more information in our series on healthy heart, healthy brain. And today we're going to focus on heart disease in women. And I'm very passionate about this, obviously being a female and also being a nurse practitioner. My background, my name is Linnea Baker, for those who don't know. In my background, I'm a board certified family nurse practitioner. I've been in healthcare over 25 years. And I did work in the cardiac ICU, a cardiology clinic, as well as worked with heart rhythm management, not just heart patients, but actually the rhythm management side and the cardiovascular side for most of my career, including as a nurse practitioner. So this is near and dear to my heart, no pun intended. And this book we're utilizing to get this information, I will share at the end, but it's Healthy Heart, Healthy Brain by Doctors Bradley Bale and Amy Doneen. And I will share that information with you at the end. But I just am very passionate about education. And this is an area where we're really lacking knowledge because there's a lot of myths and misconceptions out there on women and heart disease. So I kind of want to talk a little bit today about it. And this is coming from that book. And then we're going to cover this probably over the next couple of weeks as well. If you are a male sitting down and watching this is information that can help your moms, wives, daughters, sisters. So this is important for you to know as well and pass this information on. And women, I'm speaking directly to you about things that are important for you to be an advocate for your overall health. So thank you so much for joining me today. So first off, 1/3 of all female heart attack patients are younger women. And when we say younger women, we're in the age group of 35 to 54-year-olds, which would be my age group, okay? And this has increased in the last 20 years. Increased, guys. We're not getting better, we're getting worse. And we've talked about that in some of our other series and topics here in this platform, that chronic disease is getting significantly worse in the United States. And a lot of it we talked about was chronic inflammation and our lifestyle in the United States. And we've had a lot of talks about that. But it increased 20 years ago. It was about 1/5 of all female heart attack patients were younger women. Now it's 1/3. Okay. And remember, we've talked about how the United States is first in the world for the amount of healthcare expenditure per person, but we are 31st in the world for actual longevity in this country, in the world. So even though we spend a ton of money per person on resources for healthcare and medicine and all those things of Western medicine, we are not getting the longevity piece that other countries are getting. And we're actually getting more chronic disease, even though we have more information, more medications, more procedures, we're getting worse, not better. So that's a big red flag for me. And that's why I do this, guys. And then I cited the pages for the Healthy Heart, Healthy Brain book of where I took this information. But Dr. Erin Michos of Johns Hopkins University School of Medicine actually speaks to one of the misconceptions. And Dr. Michos says that women, this is a misconception or a myth, women are not at risk of heart disease before menopause. How many of you guys truly thought that? I think a lot of us think that. In fact, that was something that was a popular general understanding when I was in cardiology for a long time, okay? The problem is that's not the case. It's actually incorrect. And even though we know this, a lot of people still think that they're protected until after menopause, and then they should be concerned. So they don't even think that some of the things going on with them could even be heart disease. So the fact is that 1/3 of cardiovascular disease occurs before the age of 65 years old in women. 1/3 of all women with cardiovascular disease, the onset was before age 65 years old. That's very important to recognize. 1/3 of all cases, that's significant, especially if it's you. So when we talk about the gender gap in women and cardiovascular care, there was a study published in 2018. This is the journal, or the JAMA journal, which is a prestigious medical journal, okay? And this said that women are up to 3 times more likely than men to die after a heart attack. Now, that's a shocking statistic, and most of us wouldn't have known that, right? Women are up to 3 times more likely than men to die after a heart attack. And why is that? They're saying that women are less likely to be given the diagnostic tests, the same ones that men would get when they initially present. And that's because they have initial misdiagnosis is 50% higher. They misdiagnose women 50% more of the time than men because they're not looking for it in women, right? They're thinking women are protected. This is a disease of elderly men, and especially women who haven't gone through menopause yet. It's probably not that. And they're blowing it off in our healthcare system in general, okay? And so when I empower you to be educated on what's factual, you can advocate for yourself and voice your opinion and ask for the tests, okay? And in younger women, they're saying these statistics are even worse. So women under 55 years old who go to the emergency department while actively having a heart attack are 7 times more likely than men the same age to be misdiagnosed and sent home untreated. And that is just super sad because when women actually do get to the ER knowing something's not right, they're still getting misdiagnosed and sent home, which is again adding to the higher rate of death after a heart attack in women because we're not getting the same diagnostic testing they offer men because we're not being screened the same way. The healthcare system is thinking we're not at risk, and that's not true. And we need to get updated on what's actually factual and what we can do to advocate for ourselves and improve our overall health, okay? And quality of life. Because in heart disease, it's extremely important to get in earlier rather than later. And so the sooner you can find out you have the heart disease or the arterial artery disease, the better it is for you because there's more we can do to help preserve and reverse disease and help you. But the later it is, the further along it's progressed, it's a lot harder to take care of you, and you've got a lot more damage done already that can't be reversed. So just like with most things, sooner to find out is better than later, and we're not getting diagnosed soon enough in women. So surprising facts about cardiovascular disease in women, 64% of women who die from sudden cardiac death, that's a cardiac arrest, due to an MI, which is another fancy name of saying heart attack. Myocardial infarction, or MI, is a heart attack. So 64% of women who actually die from a sudden cardiac arrest, sudden cardiac death because of a heart attack, did not even know they had cardiovascular disease. And why is this? It's because of the myths. Again, the overall general rule of thumb is people believe that cardiovascular disease is a disease of elderly men. And there's actually a study that the Journal of Cardiology did, 2017. They did a survey and they said that most women and even many doctors believe that breast cancer is the leading cause of death in women. So that's why women aren't getting seen sooner, screened sooner, even in the ER aren't getting the same diagnostic tests and are having worse outcomes because it's not being caught on the radar. So actually, here's the facts. Cardiovascular disease is the #1 killer in women. 1 in 31 women die from breast cancer annually. I'm not lightening or taking away from breast cancer. I know a lot of family members and friends who've gone through breast cancer, and I'm not trying to take that lightly. Many of you know my son went through a type of cancer as well. I get from a caregiver and provider position of how serious and awful that disease or any kind of cancer diagnosis is. But to put it in perspective, 1 in 31 women die, and I'm sorry, I spelled that wrong, from breast cancer annually, but 1 in 3 women die from cardiovascular disease annually, 1 in 3, and that's 1 death a minute for cardiovascular disease in women. Again, breast cancer is a serious diagnosis, and I'm not taking that lightly, but as serious as that is, look at how serious cardiovascular disease is as well. Heart disease kills more women every year than all forms of cancer combined. And that's why I'm on this platform educating you so that you understand the real risks and you can advocate for yourself. So what are the barriers to cardiovascular disease screenings in women? Well, first of all, the primary care managers, or PCMs, they're the first line. Most women are going to go to their primary care manager, their primary healthcare provider, their PCM, with complaints or needing initial screening. Sometimes it's the OBGYN. And what happens is the PCMs or even the OBGYNs, these first line providers that get these women across their radar first, they're not finding the cardiovascular disease in women because they're not even looking for it or thinking about it. And there was a survey actually that most women had a routine physical or wellness exam in the past year, and only 40% of those received a heart health assessment. And 71% of women didn't even ask to be checked because they assumed the provider would tell them if they needed it. And again, we're putting all our faith in the healthcare provider, and the system's just not designed for that. And I'm not saying that you don't have amazing healthcare providers. There's a lot of fantastic providers out there, but the system that of medicine now has become a business. There's less time, more expectations. Providers are being pressured to get patients in and out of the office, get them in, see them for what they're needing to be seen for, and get them out. And it's a lot harder to catch everyone. And on top of that, like we said, a lot of them aren't screening it because they're not looking for it, and women aren't asking for it because it's not on their radar, on anyone's radar, and it should be. Now, what's neat is the American College of Cardiology and the American Heart Association, the ACC-AHA, they actually developed prevention for cardiovascular disease in women guidelines in 2011. And what's really cool about that is that's when I was working in cardiology, and I actually was a part of educating OBGYNs and healthcare providers, primary care managers and healthcare providers in Hawaii on these guidelines. That's something that I actually had a part in when these came out in the job I had, which was super neat because, again, I was advocating for women and educating doctors on what to be looking for and sharing the guidelines with them. And these guidelines were actually updated in 2020, okay? And again, this is the page in the book I'm getting this from. You can even look up these guidelines. We are going to talk a little bit about some of the things that in the weeks to come that you should be watching for, or that put you at a little higher risk. It can be a little tedious to look at these guidelines, but they're not awful. If you're not medical, you can read them and you can look it up. You can Google ACC-AHA prevention of heart disease, even for women guidelines, and it'll pop up, and you're looking for JAMA, ACC-AHA as the words to pull up an article that will have the actual guidelines on it if you're interested. So what's the takeaway message? As women, we need to advocate for ourselves. I will tell you, when I turned 40 years old, I knew that I was supposed to get a baseline EKG. And that's just an EKG is they put electrical leads on your chest with little stickies. A lot of you probably had these. And it's a 12 lead of different electrical images of your heart. And they recommend doing that at 40 years old so you have a baseline to compare to as you get older. So being in healthcare, I went in and asked for it. And my provider was like, really? You don't have any need for it? And I said, no, it's actually a recommendation and I want it. And because I asked for it, I got it. But I guarantee you they're not doing that on everybody that's 40 years old unless people ask. And it's not my healthcare provider's fault. It's just the way the system is run. And these guidelines come out, and there's lots of guidelines out there for lots of different things. And it takes a while for healthcare to start following the newest guidelines. It takes a while for it to catch up, unfortunately. Sometimes there's a gap. So by knowing what to ask for and advocate for, you are prepared when you go into your appointments, how to really advocate for your own overall health and take that responsibility on you. Just like when we teach you, when I talk about reading nutrition labels and what to eat and healthy lifestyles, we can't depend on other people to put healthy food in the health food aisle, to tell us that the food on the shelf is actually good for us, even though we know it's ultra processed and not. And that's why a lot of us have this chronic, well, the United States, right? We have this huge chronic inflammation, chronic disease epidemic going on, and it's hitting our kids now too. We have to be educated, and this is part of that education. And I'm so grateful that I get to be in this platform and that you're willing to show up and listen to what I have to say and share it with people that need it. Invite them on that can use this. But ask for those screenings for cardiovascular disease, and we're going to go through some more of them as we go through this series more. And remember that 50% of heart attacks and strokes occur in people that have a quote unquote normal or even optimal cholesterol level in general, men and women. So it's not just about having abnormal cholesterol that puts you at risk. And we talked a little bit about that before, so you can go back and look at those different presentations I've done. But I think in healthcare, we feel intimidated maybe when we go in as a patient, and we feel like we might ask a quote unquote stupid question, or we're challenging the healthcare provider if we ask for something. And honestly, really honestly, the healthcare providers are fine with you asking within, I mean, obviously they have to go by standard of care, but this is stuff that is published guidelines. And if you ask for it, 9 times out of 10, they're going to give it to you. And if they don't, they're going to have a reason why. And if it's not something that's published in the guidelines, you can argue with that. But I mean, I'm not saying be disrespectful. I am saying be bold. Don't assume that your healthcare provider knows everything or isn't going to miss anything. Go in prepared for your visits. Advocate for yourself in a pleasant way. I have done this and granted, I have a medical background, but for my son when I was a nurse, for my family members, for parents, for my kids, for myself, for my husband, when I need to, I go in and advocate, and I'm pleasant about it. You don't have to be rude or hateful. You can do it in a pleasant way. And I've sat down and had a discussion, even with my son's oncologist, and said, I'm just not familiar, and this is what I'm seeing in the literature, or this is what I'm thinking and why. Can you explain to me what your take is on it so I can understand better? And when they explain it to me, if that makes sense, I'm like, great. But if it's things I'm really passionate about and I don't feel like strongly that what they told me is enough to quell my nerves about it, well, then I'll ask, well, is there a reason why we can't just do it so that it's done? Whatever that is, right? Whether it's oncology for cancer, whether it's for heart disease, whatever it is. So I want to empower you to be comfortable. And I used to tell my families that I took care of, there's never a stupid question. If you don't know, you need to ask me. If I don't have the answer for you right then and there, I promise you I know where to look and I will find out and get back to you. But there's never a bad question or a stupid question. And if you don't know, you should ask. And I always felt like that was part of my job, is being able to educate you. And if I didn't know something, well, I probably needed to know it. So I'll look it up, or I know who to ask and where to find it. Okay. So hopefully you have great relationships with your healthcare providers. There's so many amazing, amazing healthcare providers out there. And I know that in general, people go into medicine because they truly care about serving others. And the system can get a little overwhelming for patients and for people working in medicine, especially now. But it doesn't mean that you can't ask or stick up for yourself or advocate. Guys, as you know, I'm on a mission to positively impact your health and wellness through education and coaching to create generational health and a health span that equals your lifespan. I really, truly am passionate about that, and I am happy to talk with you. You can reach out to me for a free health and wellness consult by commenting below or private messaging me. I'd be honored to talk with you. And of course, anything that I say or present to you guys is not meant to replace the guidance of your personal healthcare provider who knows you best. But I do want to empower you to have those conversations with your healthcare provider and be comfortable asking questions and advocating for your health. Okay. And then Healthy Heart, Healthy Brain. This is the book that this information came from. And it's a fantastic book. It's written for lay people, so you do not need to be medical to be able to read this book and get so much out of it. It's written for people with no medical background. It is literally such a huge source of information. I encourage you to get it. I got mine on Amazon. Like I said before, I have nothing to do with the book other than I have a cardiology background. I read this book and it lit me up, and there's so much great information that I felt it was a great way to present the information, highlight some of the things they're talking about that can empower you to advocate for your own health and have those discussions and know what to be aware of, and talk to your healthcare providers about your personal health and risk factors. Okay. So that being said, guys, I look forward to getting to see you again next week. And until then, I hope that you are safe, and I hope that this brought you value. I am so grateful for your time. Thanks, guys.